A beacon of hope, Dr. Alex Kintu's vision. Dr. Alex Kintu is a scientist from Uganda. His work is truly groundbreaking. He is leading research that could change the world. For many people, he represents a new dawn. His efforts are focused on preventing HIV infection. This is a fight that needs dedicated people. Dr. Kintu is one of those people. He brings hope to millions. His vision is clear, a world with less suffering from this virus. He works tirelessly towards this goal. The battle against HIV is far from over. It remains a significant global challenge. Many communities are still deeply affected. Dr. Kintu stands at the forefront of this ongoing struggle. His research is not just important, it is vital. New tools are desperately needed to prevent new infections. He understands the urgency of this mission. He knows that science can provide answers. His dedication fuels his search for better prevention methods. This is a fight for human dignity. Dr. Kintu is a key figure in the development of a drug called Lenacapavir. This medicine is designed for HIV prevention. It has the potential to transform many lives. This is especially true in regions like sub-Saharan Africa. These areas bear a heavy burden from the HIV epidemic. Lenacapavir offers a new kind of hope. It could be a powerful weapon in our arsenal. Dr. Kintu's leadership in its development is crucial. His work is a testament to innovation. The story of Dr. Alex Kintu is one of unwavering dedication. It is a powerful example of science serving humanity. He is a true inspiration to many around the world. His journey from Uganda to leading global research is remarkable. It shows what is possible with passion and perseverance. He reminds us that individuals can make a profound difference. His work is more than just a scientific endeavor. It is a deeply human one. He fights for a healthier future for all. The promise of Lenacapavir, a perfect score. Recent news from a major clinical trial has been astonishing. The trial is called Purpose 1. It tested the drug Lenacapavir. The results showed 100% efficacy in preventing HIV. This means it was perfectly effective. Such a result is almost unheard of in medical research. It is a truly remarkable achievement. This news has sent waves of excitement through the scientific community. It offers a powerful new hope. In this trial, no woman who received Lenacapavir became infected with HIV. This is an incredibly powerful finding. It demonstrates the drug's real potential to protect people. The trial was large, involving over 5,300 women and adolescent girls. They came from South Africa and Uganda. These are countries where HIV rates are very high. The drug was compared to existing prevention methods. Lenacapavir clearly showed its superior protective power. This is a significant breakthrough. This success is a major milestone in the fight against HIV. It represents a giant leap forward in prevention science. For many years, scientists have dreamed of such a tool. They have searched for a highly effective, long-lasting prevention method. Now it seems that Lenacapavir could be that tool. The data is compelling and offers strong evidence. This could change the landscape of HIV prevention. It is a moment of great optimism, the purpose. One trial was conducted in South Africa and Uganda. These are regions that have been disproportionately affected by the HIV epidemic. The results bring immense hope directly to these communities. This is where the need for new prevention options is most urgent. The success of Lenacapavir in these settings is particularly meaningful. It shows the drug can work where it is needed most. This is a victory for global health equity. Empowering young women a shield against the epidemic. Adolescent girls and young women face a high risk of HIV infection. This is particularly true in many parts of sub-Saharan Africa. They are often made vulnerable by a complex mix of factors. These include social inequalities and economic pressures. Lack of access to education and healthcare also plays a role. They need effective ways to protect themselves. Their health is crucial for their communities. This is a matter of justice. Lenacapavir could be a transformative tool for these young women. It offers a method of protection that is both discreet and long-lasting. This is incredibly important for many. It gives them more control over their own bodies and health choices. They would not need to rely on a partner's cooperation for protection. This autonomy is empowering. It allows them to navigate their lives with greater safety. This drug could truly change their futures. Current HIV prevention methods often have limitations. Taking a pill every day can be challenging for some. Stigma associated with HIV can also be a barrier to accessing prevention. Lenacapavir offers a different approach. It is given as an injection just twice a year. This makes it much easier to adhere to. It is also more private. This convenience and discretion could lead to wider acceptance and use. It addresses real-world challenges. Empowering young women is absolutely key to ending the HIV epidemic. When young women are healthy and safe, communities thrive. Protecting them helps to protect future generations as well. Lenacapavir offers a powerful new way to achieve this. It can help to break the cycle of infection and vulnerability. It is more than just a drug. It is a tool for empowerment. It provides a shield, allowing them to fulfill their potential. Echoes of the past. Uganda's struggle with HIV. Uganda has a long and painful history with the HIV virus. The epidemic arrived with devastating force in the 1980s. It swept through communities, leaving a trail of loss. Many lives were cut short. Families were torn apart. The social fabric of the nation was deeply wounded. Healthcare systems were overwhelmed by the sheer scale of the crisis. It was a time of immense suffering and fear for many. Dr. Alex Kintu grew up in Uganda during these difficult years. He witnessed the impact of HIV firsthand. He saw the suffering in his own community. He understood the profound loss that families endured. These early experiences left an indelible mark on him. They shaped his understanding of disease and its consequences. The epidemic was not an abstract concept for him, it was a harsh reality that surrounded him. The people of Uganda fought back against HIV with courage and resilience. The country's early response to the epidemic was widely praised. Public health campaigns raised awareness. Support networks were established for those affected. There was a strong sense of national unity in facing the crisis. However, the scars of that era remain. The fight against HIV in Uganda is not over. The virus continues to affect lives. The memory of that devastating period fuels the ongoing search for better solutions. It drives scientists like Dr. Kintu in their work. They are determined to prevent such widespread suffering from happening again. They seek a future where communities are not ravaged by this disease. Their work is a tribute to those who were lost. It is a commitment to protecting future generations. This history provides powerful motivation. Section 5, A Personal Crusade. Kintu's early motivations. For Dr. Alex Kintu, the fight against HIV is not merely a professional pursuit. It is a deeply personal mission, a crusade born from early life experiences. Growing up in Uganda, the HIV epidemic was an inescapable part of his childhood. He saw friends, neighbors, and family members directly affected by the illness. The pervasive sense of loss and the struggle of communities left a profound impact on his young mind. This was not just a distant problem, it was real and close. The shadow cast by the epidemic was long and dark. It touched every facet of daily life in his community. Healthcare facilities were strained beyond their limits, often lacking resources. Hope itself sometimes seemed to be in short supply. Witnessing this environment, the vulnerability of people, and the desperate need for solutions solidified a resolve within young Alex. He understood from an early age the critical importance of health and the devastation caused by its absence. These formative experiences guided his path. He decided that he would dedicate his life to combating disease. He felt a strong calling to make a tangible difference in people's lives. The field of biomedical research offered him a way to pursue this goal. He aimed to be part of the solution, to contribute to the scientific knowledge that could alleviate suffering. And his choice was not accidental, it was a deliberate response to the world he knew. Dr. Kintu's powerful motivation stems from a deep well of empathy. It is also rooted in a profound desire for justice and health equity. He wants to ensure that others do not have to endure the same suffering he witnessed. He seeks to change the narrative for his people and for vulnerable populations globally. His work is driven by a fundamental belief in the value of every human life. This personal connection gives his scientific work an added layer of urgency. Section 6. Forging a Scientist, the Harvard Years. Dr. Alex Kintu's journey towards becoming a leading scientist took him to Harvard University. This institution is renowned globally as a center of academic excellence. Admission to Harvard is highly competitive. His acceptance was a testament to his intellectual gifts and dedication. There, he embarked on rigorous training in biomedical sciences. He immersed himself in his studies, driven by his ambition to tackle global health challenges. He was determined to make the most of this opportunity. At Harvard, Dr. Kintu significantly deepened his scientific knowledge. He had the privilege of learning from some of the world's foremost scientists and researchers. He actively engaged in cutting-edge research, honing his skills in the laboratory. His academic focus was sharply aimed at infectious diseases. The problem of HIV, which had so profoundly affected his homeland, remained a central concern in his studies and research interests. He absorbed information like a sponge. His time at Harvard University was truly formative. It provided him with the advanced tools and critical thinking skills necessary for a career in high-level research. The challenging environment pushed him to excel. It prepared him thoroughly for the complex world of drug development and clinical trials. He emerged from Harvard not just with a degree, but with a refined vision. He was ready to translate his academic learning into practical action that could impact global health. This foundation of academic excellence was absolutely crucial for his subsequent achievements. It laid the groundwork for his innovative work on new therapies and prevention strategies. His unwavering dedication to his field was evident even during his university years. He was not just pursuing a career, he was pursuing a calling. He was driven by a clear purpose: to make a significant and lasting impact on the fight against devastating diseases like HIV. Section 7, From Academia to Action. Kintu at Gilead Sciences. Following his distinguished academic career at Harvard, Dr. Alex Kintu transitioned into the biopharmaceutical industry. He joined Gilead Sciences, a company recognized worldwide for its pioneering work. Gilead is particularly known for its development of antiviral drugs, including transformative treatments for HIV and hepatitis C. For Dr. Kintu, this move represented a significant step. It allowed him to apply his research skills directly to the creation of new medicines. This was where science met real-world impact. At Gilead Sciences, Dr. Kintu has risen to become a key figure. He now holds the important role of leading clinical development for Lenacapavir. This is a position that carries immense responsibility. He oversees the complex process of testing the drug in human trials. This involves meticulous planning, rigorous execution, and careful analysis of data. His leadership ensures that these trials are conducted to the highest ethical and scientific standards. His expertise guides the drug's journey. His daily work involves managing intricate research programs. He collaborates with diverse teams of scientists, doctors, and researchers spread across many countries. Effective communication and coordination are essential to this global effort. Dr. Kintu's leadership is vital in navigating the challenges of drug development. He ensures that the research stays on track and meets its objectives. The progress of Lenacapavir relies heavily on his guidance and scientific acumen. He is a bridge between the laboratory and the patient. Dr. Kintu's accomplishments during his time at Gilead Sciences are already substantial. He is playing an instrumental role in bringing a potentially revolutionary HIV prevention drug closer to reality. His expertise in clinical research and his deep understanding of HIV are making a tangible difference. He embodies the spirit of translational medicine, taking scientific discoveries and turning them into practical solutions that can improve human health. His contribution is a testament to his skill and dedication. Section 8, Beyond Borders. The global implications of Lenacapavir. If Lenacapavir receives regulatory approval, its impact could be truly immense. This drug has the potential to transform HIV prevention efforts on a global scale. Millions of lives around the world could be protected from infection. This is a profoundly exciting prospect for public health. It offers a new horizon of hope in a long and difficult struggle. The world has been waiting for such a breakthrough. It could change the trajectory of the epidemic. Regions like South Africa and Uganda, which bear a disproportionately high burden of HIV, would benefit enormously. These are the places where the Purpose 1 trial showed such stunning success. However, the need for effective HIV prevention extends far beyond these countries. Many communities worldwide continue to face the threat of HIV. Lenacapavir offers hope to all people at risk, regardless of where they live. It is a tool for global health security. The long-acting nature of Lenacapavir is one of its most significant advantages. It is administered as an injection just twice a year. This overcomes many of the challenges associated with daily pill adherence. For many people, remembering to take a pill every day can be difficult. The simplicity of a biannual injection could dramatically improve the effectiveness of prevention programs. It makes sustained protection more accessible and practical for more people. This is a key factor in its potential. Ultimately, Lenacapavir could play a crucial role in reducing health inequalities. It has the potential to empower the most vulnerable populations. These are often young women, men who have sex with men, and other marginalized groups. By providing a highly effective and convenient prevention option, it can help to level the playing field. It represents a major step towards controlling and perhaps one day ending the HIV epidemic. The global health community is watching its progress with keen anticipation. Section 9. A future free from fear, the road ahead. The journey of Lenacapavir towards widespread availability is not yet complete. Regulatory approval from health authorities like the FDA and EMA is the next crucial hurdle. This process involves a thorough review of all the trial data. More research will also continue to understand its long-term effects and best use. However, despite these necessary steps, the promise of this drug is undeniable. The results so far have been exceptionally strong. There is great optimism for its future. Dr. Alex Kintu's work provides a powerful reminder of the incredible potential of science. It demonstrates how unwavering dedication and innovative research can lead to life-changing breakthroughs. His story, and the story of Lenacapavir, inspires hope for a healthier future for all humankind. His contribution to this field is already monumental. He stands as an example of how one individual can help to shift the course of an epidemic. Science offers pathways to progress. A future where HIV is no longer a widespread threat is a future we can strive for. It is a future that seems more achievable with tools like Lenacapavir. This drug could become a cornerstone of prevention strategies worldwide. It offers people the chance to live their lives free from the constant fear of HIV infection. This is the ultimate goal of all prevention efforts, to restore security and well-being. This is what Dr. Kintu and his colleagues work towards. The world owes a profound debt of gratitude to scientists like Dr. Alex Kintu. They dedicate their lives, often working tirelessly behind the scenes in pursuit of a better world. Their relentless efforts bring us ever closer to conquering devastating diseases. The fight against HIV continues and challenges remain. But thanks to the work of people like Dr. Kintu, hope shines brighter than ever before. The road ahead looks more promising.